I've got JT here today, our osteopath. There's a lot of conversations that we have. We constantly get the conversations about what is osteopathy, what's the difference between osteopathy and chiropractic. And I figured this is a good opportunity to just have a discussion about it, but also get to know JT and what osteopathy is all about. So let's get cracking. So first of all, how did you get into osteopathy? What made you decide you want to be an osteopath?
So I got into osteopathy through a family member who is an osteopath, and they actually treated me once because I used to suffer with a lot of knee pain as a footballer, as an avid runner as well. Anywhere I'd sort of, anytime I'd play football, constant pain in my knees, especially as a teenager, and nothing was sort of helping. Icing, things like that, was doing everything, exercises, you sort of name it. But then I had one treatment from my family member and realized, wow, like I feel pain-free after one session. I go, this is amazing. And from there on, I think that's what kind of clicked in my head. This is what I want to do. And if I can give back to someone who's in my sort of position at that age, I definitely want to do that. And especially people that are younger and how they can be preventative to issues like this.
Did you kind of get like a proper wow moment with that?
Yeah, pretty much. I was genuinely shocked by how effective it was after one session. It's crazy.
It's amazing. I had a similar thing when I was looking to be a chiropractor, and I had physio, I observed physio. I thought I was going to be a physio.
Yeah.
And I one day went to observe a chiro for a day, and there was this kind of bulb moment. I was like, wow, this is what I want to do.
Yeah.
And so you kind of got that same sort of feel when you had the adjustment.
Yeah, well, yeah, exactly. And it wasn't even necessarily just the adjustment, it was everything overall. I was just like amazed in how comfortable I felt and sort of how sort of in depth that, my cousin, she went into sort of, analysing, things like my gait and, my squats, my lunges, little things like that. So, and that obviously I'm quite, intuitive about these types of things. As I said, I play a lot of football. So, anything to get that extra edge. And, from there on, I've just been going up and up and up and just learning more and more about the body. And yeah, that's kind of where it clicked for me.
Yeah.
Quite literally.
And so obviously you kind of, what age were you then when you kind of had that adjustment?
I was 19.
Yeah.
And I was actually studying computer engineering. Yeah, at University of Westminster. And I realized this computer engineering is not what I want to do sort of further on in my life. I personally couldn't sit in an office. I've got to be active. I've got to be sort of, I want to be sort of down to earth with people and, talk to people. It's just the way I am, and I want to sort of teach others and sort of learn as well from others. And for me, an office-based job probably wasn't the best thing for me. So I realized, what do I like? I like sports. This is something that sort of has kind of pushed me to kind of go further, osteopathy that is. And yeah, since then I've never looked back, and best decision of my life.
Yeah. So you went straight into university at that point?
No, not necessarily. So I dropped out of my first year of computer engineering, and then I took a gap year because I wanted to figure out what it was exactly what I wanted to do. It was a very sort of a big decision for me, especially in terms of my family saying, what are you doing? Why are you doing this? You shouldn't be dropping out. You've got to stick to it. But I kind of took the plunge and went, this is what I want to do. I want to go into osteopathy because I feel like this was going to be the most rewarding thing for me. So from there, I managed to get on a sports massage course, done my anatomy, physiology, and practical at St. Mary's. And then that same year, so I believe that was 2018, I believe it was. And yeah, from there on, from 2018, I got into the 2018-2019 year one of osteopathy and literally got my master's at the end of it. So yeah.
Nice. And when did you qualify?
2022.
2022. Yeah. So what's that now?
3 years. Yeah, 3 years.
3 years qualified.
Graduated, yeah.
And do you feel like it's been still, even then, it's a steep learning curve, right?
Oh yeah, I mean, I wouldn't even call it 3 years because technically in our year 3 at university, obviously year 3 and 4, we are treating patients. Yeah. So if you want to add 2 more years onto that, it's 5 years experience, really and truly. But it's 3 years when you're kind of on your own, you know, you're not sat with, you know, your driving instructor, if you want to call it. It's actually, you're on your own, you know, you've passed.
You've got your license, right?
You've got your license, literally, and that's all it is. Get cracking, literally, yeah.
So yeah, bad pun. And so now, obviously, we were saying about the difference between chiro and osteopathy. First of all, let's what is osteopathy to you? In your own words, without kind of textbook style, like reading it off, this is what I'm taught to learn, because we've been in the same boat.
Yeah.
This is what I'm taught to tell you osteopathy. So in your own words, what's osteopathy?
So in my own words, osteopathy is essentially accelerating the process of healing and essentially making you feel better and move better, in a way, in a nutshell, essentially. The way I like to kind of put it, if someone asks me what is the difference between an osteopath and a chiro, I tend to sort of go down the route of saying the journey is a little bit different, but the destination is always the same.
Yeah.
Okay, it's just more so to do with techniques, different techniques that we're taught as osteopaths, and I'm sure as chiros, you guys are probably taught different techniques to us, but essentially they're there to do one thing: get you better, you know, make you feel better. So,
yeah, and also there's often a crossover, right? Like we want to get your license to do all these different adjustments, but over time you learn, and you might get experience from someone else. So you go, actually, I like that adjustment, I use that, and there's a massive crossover between the two, the types of adjustments.
That's all it is. It's all about being a crossover, in my opinion, where you might take tools out of my toolbox, I might take tools out of the chiro toolbox, and the same with physios. It's all about sort of becoming this one practitioner as a whole, how you want to become.
Yeah, exactly. So it's more personal, right? It's about your personal journey, your experience, like from being adjusted by your cousin.
Exactly.
How you like to be adjusted, and then that treatment you form in your head, you kind of tweak as you learn, as you go, and it changes over the years to this point where like, this is what I've got.
That's all it is, honestly.
I think that's probably, I'd completely agree with what you're saying, because I think ultimately we're both trying to do the same thing. Everyone's trying to get the person better. Yeah. And the reason that you're doing, or the philosophy behind why you're doing it, might be different from different schools, but actually
that's all it is at the end of the day. It's different philosophy.
It's the philosophy. And you do an adjustment, what does it affect? It affects the tissue surrounding it, affects the nerves, it affects circulation. So whether you're a chiro and you're like more nerve oriented, or you're an osteo,
more with the healing side of things.
Exactly. You're kind of, either way, both happen with what you're doing.
Exactly. Yeah. That's what it is.
It's a really tough question to ask, or answer rather.
Yeah.
Because, I guarantee you, even with the receptionists that we've got there, I guarantee you I could do a recording of them and ask them straight, what's the difference between osteo and chiro, considering we have both of them.
Yeah.
And it's hard for them to answer, but of course it is. I mean, it's actually hard for me to answer.
Yeah, well, I'm exactly
because actually, the way I end up saying it is ultimately you said the journey. I think that's a perfect way of explaining it. But it's all about, if you're picking one or the other, it's about that personal preference and that attachment to the practitioner and the trust with the practitioner, opposed to the trust with the form of treatment.
Yeah.
Right? So whether that person be an osteopath, whether they be a chiro, whether they be a physio, if you go to have that treatment with them and you feel that you're looked after, you're trusted, you trust them.
I think it's similar to if you were to go to a barber shop, for example. You have your one barber, you trust them, you know exactly what they can give you, and then if he goes on holiday, you're a little bit reluctant. But at the end of the day, if he's given the recommendation of saying, look, go with this guy, it's absolutely fine. You're still going to get the same result. Might be a little bit different, you might put your head in other positions, but you're still going to get the same result at the end of the day. So a little bit similar in that sense, but yeah, it's essentially preference. That's all it is. Yeah, that's all it comes down to.
Yeah, and I think once, like you said about the kind of referral side of it, is if you've got a friend or family member who's like similar mindset to you, or like, and they know you pretty well, and they've referred you to see someone.
Exactly.
The likelihood is you're going to get the same sort of experience, and you're going to trust them.
Yeah.
And often that's what we see all the time. It's like I have people go, I'd like to see I don't want to see osteopathy. I want to see a chiropractor, and you're like, okay, that's fine. That's just that's what they say.
Yeah, that's all it is.
But like that journey of them getting to you is different.
Yeah.
But actually, the result can often be quite similar.
That's all it is.
Yeah. All right, so someone comes in for a initial osteopathy consultation, so their first visit to see you. What can they expect from seeing you?
So that essentially is us guys doing the detective work. So we're basically trying to figure out how you've got to where you've got to this current moment in time. So, you know, asking detailed questions, you know, about your general health, and also doing assessment, you know, of sort of the body examination of the, you know, your neurological system, you know, just seeing sort of your ranges of motion, you know, little things like that. But we're going into depth to how you've kind of got to that. So that's kind of, you know, the aim essentially, and then we're able to kind of formulate like a diagnosis from there, and then from that we can formulate like a plan essentially. So then we know exactly what it is, what's going on, you know, how many sessions you might need, you know, whether you need to be pushed in a different direction. So, you know, we want to kind of get down to the bottom of it essentially. That's kind of the aim.
Yeah, no, I guess so the plan is quite personal, right? So it's, you know, how can you distinguish between plans? You know, some people are going to need more sooner, like in a short space of time, some gapped up.
Yeah. So, for example, you know, a good example of this is sort of, you know, say your 21-year-old athlete, you know, they're probably going to recover a lot quicker than, you know, 90-year-old Doris. So, you know, we have to kind of tailor it, you know, to each individual, and just essentially specify it, you know, for their needs. So it's not sort of like a, you know, for everyone, this is how many sessions you need. It's all individualized. So that's important to remember.
And I guess, do you have a similar thing? Obviously, chiropractic is not a set tone of what the plan looks like, but certainly with us guys here, what we've been really happy with, you know, working with you is that you sing from the same hymn sheet. We're all about the fact that you don't just adjust and just think that it stops there. We've got to work out why you got there, and how we're going to stop you coming back to this point.
There's so much to it than just an adjustment, in my opinion. I think there's a lot more that can be done always. You know, an adjustment is only sort of, you know, the tip of the iceberg, I would say. There's a lot more that goes on underneath, you know, mobilizing the spine, you know, trigger point therapy, you know, there's so much more to it. So, you know, it's not just an adjustment, it's a lot more than that.
Yeah, and the body's complex, right? It's not as straightforward. You can't just expect that one thing will just sort everything.
Exactly.
We're much more complicated.
Yeah, much more complicated. It's important to remember that, you know, obviously us guys, we all went to university for minimum, I'd say 4 years or so, studying the body. So we understand it to that level where, you know, everything is affected. As a result, everything is affected, and that's kind of the aim of the game. We want to make sure that we're doing as much as we can as opposed to doing as little as we can. So that's important to remember.
Do you think you have to believe in osteopathy for it to work?
I think if you believe in your practitioner, then yes, it will work, as opposed to believing in the actual, you know, osteopathy or the actual title, or, you know, chiropractic, or, you know, I personally believe it's the person that you're with, you know, it's not necessarily the title, because a lot of osteopaths might work differently. A lot of chiropractors might work differently to your traditional, you know, you can have structural osteopaths, you can have cranial osteopaths, visceral osteopaths. So again, it comes down to the person and who you're most comfortable with.
Definitely, I'll completely agree. Plus, you think of osteopathy, you think of physio, you think of chiro. These are evidence-based. So it's like, there's the research to prove that these things work.
That's it.
And then the question is who you're comfortable. There's something that research can't necessarily put together. Is like how well that your connection with that patient can be.
Yeah, basically, yeah.
What do you think is the most important thing in building to build a trust with a patient?
I think sort of understanding the patient's, you know, goals, you know, what they want to achieve, and then you sort of working with them to achieve those. I think that's really important, because at the end of the day, you know, patients have come to you for a reason. You know, they want to get better. Essentially, most of the time, that's what it is. Some patients do want to get to, you know, they want to maintain their health, and you know, if you can sort of help them achieve their goals, and if you can even push them to even bigger goals, you know, I think that's where you gain the respect from a patient, and you know, you build your rapport with them, and then, you know, more and more people will understand, because I think word of mouth is the biggest thing. You know, people say, oh, you know, I heard you done your back in, you know, where did you go to get sorted? You've been absolutely fine for the past 5 years. And they say, you know, you went down to the osteopath down the road, or the chiropractor down the road. And, you know, I think it comes down to the person, as opposed to, you know, just doing, you know, going anywhere.
Whatever it is.
Yeah, literally.
Yeah. Is there a case that sticks in your head as like one of your proper achievements, or like one that would go, yeah, I'm really proud of that treatment or that kind of approach?
Yeah, I would probably say a patient of mine who had a partial Achilles rupture. He just used to play five-a-side, you know, goals, power league, and yeah, he managed to rupture his Achilles whilst playing, and he was out for quite a while, to be fair. And he came and saw, so he found me off of, you know, word of mouth, off of someone, his friend that I used to see, and managed to start seeing me sort of 2 months or so after the rupture. And yeah, we managed to work so hard, from essentially him being unable to weight bear at all, being in a boot, being on crutches, 2 crutches, to back to playing again. You know, sort of, it took roughly around about a year or so, but we kind of got there because, you know, he was quite religious with his treatments. You know, I told him, I go, this is what needs to be done. He followed sort of the recipe, as you would say, and yeah, we managed to sort of get there, and now he's playing sort of I'd probably say 2-3 times a week. I see him sort of on the pitch, you know, on his Instagram and stuff, and you know, that brings me joy. And if anyone ever sees that, it's, you know, I know that sort of, I can say that I've helped him. If anyone's in that position, you know, just come to me, can help you out in that sense.
Excellent, yeah. And are there specific types of conditions that people have to come see an osteopath?
No, there's no one condition that you need to have to see an osteopath. You can be the fittest and healthiest person in the world. You can be Cristiano Ronaldo. You know, you can be, I don't even know who else. You can be Usain Bolt. You can be absolutely fit as a diddle, and you can still see an osteopath or a chiro, physio. They're all there to aid you in sort of your health. You know, we want to get you to that path of wellness. That's kind of the aim, and keep you there. You know, we want you to always be improving and getting that extra edge. So it's not a hindrance in any way, and you know, it's not there for just people that are in pain. You don't have to be in pain to see an osteopath or a chiro, physio, whoever. Yeah, it's all there to get you well.
Cool. And what conditions would you normally see? What's the sort of person, or sort of condition that you would normally end up treating?
Well, we do find that people have in recent years, obviously, of course, because of COVID, been suffering with, you know, headaches, things like that, tension type headaches, you know, lots of stress related issues, you know, neck pain, you know, things like that, just due to being at a desk, you know, pretty much for 8-9 hours daily, you know, Monday to Friday. Unfortunately, our bodies weren't made to do that. As, you know, humans, you know, we were made to hunt and, you know, to find food, things like that. And taking us out of that adaptation, this is why we get pain. Pain is there for a reason. It's there to tell us that there's an issue, and you have to listen to it. You know, it's like, for example, on a car, when your engine light comes on, you're not going to put plaster over it. You're going to take it to a mechanic and get it sorted, and your body is no different. So that's an important thing to remember.
Yeah, definitely. What sort of conditions would you normally see as an osteopath?
So commonly we see a lot of sort of, you know, neck pain, low back pain, sciatica, headaches, you know, pain going down the arms, you know, electric shock type pains, But that's not the only thing that we see. We also see sort of, knee pain, ankle pain, sporting injuries. It's not just necessarily sort of spine related. There's a lot more to it. Like I say, we look at everything, as to your finger almost, if you want to call it at that level. So it's not just always about only the spine. It's also about, looking at sort of your extremities as well. And yeah,
cool. And with the type of treatment, I mean, the common thing that we end up hearing a lot with the type of treatment is, well, chiros are much harsher than osteos, like they're firmer, and chiros don't do any muscle work, but osteopaths do mainly muscle work.
Yeah.
What's your take on that?
So I think that is, it's fair. I think that has stemmed from osteos coming out of university and sort of being taught to be very gentle in cases. I think they've kind of put a parachute on us quite a bit from when we graduate, but it's for us to kind of take that parachute off and say, no, we're going to go straight in, dive right in. One thing I notice with chiropractors is they get to the point, and they sort of just go for it, as opposed to osteos. We can sometimes beat around the bush a little bit. But it's not to say that you still can't get the same effect, of course, but there is a fine line of actually, getting into work and sort of, doing it.
Yeah.
So
would you say that osteos generally will do more kind of muscle work than manipulation, whereas chiros do more manipulation? Overall, I mean, what's the difference?
I think,
would you say in that sense, but also from the way your approach? So what is...
Personally, so I can speak obviously on myself. I mean, I like to sort of go right into it and get sort of into the nitty-gritty of things. I don't want to say that I'm very gentle, because I can be sort of, I want to be hands-on, getting into, like I say, the nitty-gritty of things. A lot of, like I say, new graduates, you are taught to kind of be very conservative of your skills, but you should be sort of championing them. So that's kind of something that I found quite difficult, my first 6 months of practice. But then again, the parachute kind of came off and I realized, I can actually go for it, and you just build confidence. I think confidence is a big thing for a lot of chiros as well, not just osteopaths, but I just think that you guys have probably been taught to be a lot more confident in your ability, trust yourself. I think that's what we probably weren't really taught as much as we could have been. But I feel like me personally, I'm at that stage where I'm so confident. It's just like, I know it like the back of my hand. I don't have to worry or think anything. So yeah.
That's a great place to be as well, isn't it? When you're comfortable with it and you kind of got your art there, and you've got, like you said, the tools and the toolbox.
Yeah.
Pick out which tool you want to use for that particular person. Mold it depending on what the person's needs are. So
yeah.
whether you go in firm with someone or whether you go gentle is completely down to the person, right?
Exactly.
Yeah,
Again,
so,
like we say, it's always individualized for that person. You're probably not going to adjust a 90-year-old Doris, using the same force that you would for a 21-year-old athlete. That's my biggest two examples that I always give. No one treatment is the same. It's always different.
So obviously our like you did touch on it already, the modern lifestyles and everything like that has impacted on us. Is there a way that you feel that has impacted us on the type of people that you're seeing?
I would say that we are seeing a lot of people that work from home, probably because they've not had proper ergonomic setups. They've sort of, they're sitting on their dining chairs and whatnot. And a lot of people have, in a way, I guess, started taking up, sports as well, running and stuff, because they actually have more time to do so. So, we are actually seeing quite a lot of conditions, ranging from, like I say, headaches to sporting injuries. So there is a big sort of, there's a big change. I would imagine from what you might have seen, say, 20 years ago as opposed to now. I don't know. How do you feel?
Thanks for mentioning. Been practice over 20 years. Appreciate that. I would say there's a definite difference, definitely from like COVID, and in the type of the problems, but not just the type of problems that we're seeing. I think also the response after being treated, I feel like the majority of people now need to have a little bit more education on how to move correctly and how to move more. You see it all the time, and people are expected to work from home, and when they're at home, they're expected to be locked in that whole time. Before, they may have walked to work, they sat at the desk, started to do something, gone and got a cup of tea, they had breaks, set breaks in, set lunch, and now you're starting to hear and see people who they're at home working, and they have lunch at the desk. You know, that's how focused they have to be on their work, because now there's less opportunities to move. So it's all about kind of the type of person that's coming in, but how they're responding afterwards. And they need a slightly more education on how to move better.
Yeah, I think education is a key one. Giving a patient sort of something to take away is important, you know, because if they don't have anything to take away, they're just going to solely rely on you. That's not the case. You know, patients should, you know, essentially, like I say, my philosophy is I'm accelerating your healing process, but at the same time, you have to want to help yourself. And if you don't do your homework, you're going to kind of plateau as opposed to go in that direction, go up. So.
And also the fact that they've made that step in their journey to come see you.
Exactly,
right?
And you don't want to.
That's the first step.
Yeah.
That's the fact that they've actually picked up the phone and gone, you know what, this is bad enough now that I need to do something about it. It's definitely the biggest start of that journey.
Exactly.
But then it's understanding that it can't just be the one thing often. It's got to be a number of things, and it's got to be changing lifestyle, because that's what got you there in the first place.
Yeah.
You know, if you're in pain because of something, you've got to change that something.
That's it.
And prepare your body better for that something.
Yeah. No, it's true.
Yeah.
You're right.
If you could give someone the best tip on how best to improve their posture at their home desk, what would that tip be?
Force yourself to sit upright, you know, make it something subconscious rather than conscious, you know, because if you're slouching and you know you're doing it, you're going to kind of want to correct yourself, and then you could change that, as opposed to you slouching, you will stay like this, you know. So, you know, it's just tricking the mind, if you want to call it, you know, just changing it around. I always tell people consciously start like that, and then eventually it will become subconscious. So yeah.
If you weren't an osteopath, what do you think you would choose to do?
Ooh. I think I've told my wife this before. I'd probably be a driver of some sort, maybe like a truck driver, probably. Yeah.
You know what, it's really funny you say that, because when I was, I think from a young age, even from 10, I just loved driving, and anything I wanted to be, anything to do with driving. So I'd have people come and say, oh, what do you want to be, Steve? And I'd be like, I'm pizza delivery man, I don't know. I'll be anything that involves me driving a car.
Oh, driving's therapeutic. I find it therapeutic, so yeah, being a truck driver.
Yeah, stick your music on.
That's it. It'd be.
Don't have to think about too much other than what's surrounding you.
Yeah, exactly. You know exactly where you're going somewhere different. You know, it's always good to see sort of different things. So I like interacting with different people, you know, it's part of me.
Maybe we can work something to combine the two.
Yeah.
We'll get a big lorry with like a little clinic in the back of it, and you can drive up.
Mobile clinic.
Mobile lorry clinic.
Yeah. We'll have set points each sort of day. Go from London, Manchester, Newcastle, you know.
We're on it. Okay, this is, by the way, this is a duo, all right?
You heard it first, see?
Yeah. What's your favourite kind of recovery hack for yourself? So when you're starting to feel something go on, or like what do you do? What do you turn to?
Ooh, I would say I actually I don't carry on, but I probably lower the intensity of what I'm doing, you know, because I still think you've got to be moving, you know. Your body's sore, but you've got to still flush out the toxins. You're not going to just sit there. It's always good to keep moving around still and just get the get all the rubbish out of the body, so that's kind of my recovery hack. I don't know.
Is that what you're going to tell everyone?
I don't know how many people would agree with me though.
You're going to tell that dude with a ruptured Achilles?
Probably not. But it's about sort of doing as much as you can.
Yeah.
I still told him you got to keep moving as much as you can, to a comfortable level, not sort of going overboard, not doing pogo jumps, anything like that, so.
It's within your range that your body's allowing, right?
Exactly. And if your body's allowing it, do it. Make use of your body. You've been given a body for a reason. You might as well make use of it.
So you've got back pain.
Yeah.
All right. Are you going to turn to an osteopath or are you going to turn to a chiropractor?
An osteopractor.
The combos.
Basically.
Yeah? A chiro on one limb, an osteo on the other.
Why not? Nothing wrong with that.
Strong answer. What would you say is the benefit of having various practitioners under one roof?
I think you can kind of find your right person. The more people there are, the more likelihood you have of finding the right person. As opposed to, obviously, if you had one person and you didn't really sort of not get on, but if you didn't click, then you're probably going to go elsewhere. Whereas you can try, other people, and it's somewhere that you trust as well. Especially if it's local, that's even better. That's a bigger bonus. So,
yeah, definitely. And from a practitioner perspective, so like you working in a clinic where there's lots of different types of treatments.
You learn so much. Like me personally, I've really learned so much off of Dan and Flavio, who do fascial manipulation, that I'm actually going on a fascial manipulation course now. So, you kind of got to be with people that you are going to rub off of in a way. So, that's the environment, me personally, that I want to be in, with people like that. Yeah, exactly. So
everyone supporting each other.
Yeah, exactly. That's all it is.
Yeah, cool. Do you think, we mentioned about the kind of title of the treatment, but how important do you think it is to a patient in pain to the title of the treatment opposed to the practitioner that they see?
I don't think the title is necessarily like the most important thing. Again, I think it's the practitioner. I feel if they are comfortable with that practitioner, then at the end of the day, the practitioner is going to be doing everything that they can to kind of get them better anyway. That's basically the osteopathy, chiropractic, physiotherapy aspect of it anyway. But what will accelerate it a lot faster will be the person, telling you the right things to do, the education, things, it's not just about the treatment. It's always about, in my opinion, the person that you're going to see. So, yeah, I mean, if you're in pain and you're sort of looking for someone, it's got to be someone that you, as you said, you click with. So that's the important part, I'd say.
You got someone who's their body's just letting them know there's something going on. They've got a shot of pain. Yeah, they need to do something about it. What's the next steps?
So what I'd say is booking for a consultation. So this is where we'll go through sort of everything. We'll get the ball rolling, in essence, doing our detective work. Or if you're unsure in what, how you want to proceed, you can always come in for a free 15-minute chat. We can always point you in the right direction. Yeah, so essentially the first part is picking up the phone, making that first step to essentially that journey of well-being. You can even book online. Yeah, we can basically take it from there.
So you got one tip to give to a gym goer or athlete, whether they'll be rugby player, footballer, whatever it is they are, what would that tip be?
Prehab.
Prehab?
Yeah.
What's prehab?
So prehab is essentially priming your body for your form of exercise. So for example, for football, making sure that you reduce the amount of injuries that you may get. And this is done by sort of exercise treatment. It's important to do your prehab, because if you're not going to do your prehab, you're more likely to get injuries.
Okay, give me one myth that you would love to bust about osteopathy.
That we're gentle. So come here. And you'll see.
And you'll find out.
And you'll find out.
There's only one way to find out.
Basically.
Pick up the phone, guys.
Basically. Yeah, I'm trying to think. I mean, that's probably what I would say.
Yeah.
Yeah, I think a lot of people think, oh, osteopathy is just muscular work. No, it's not.
Yeah.
It's not that at all. Oh, what's this?